Good morning. Today we're going to do the neonatal resuscitation. First, I have already provided an area for delivery. I have also washed my hands and worn my gloves, and also provided an area for our ventilation and also checked the equipment. So first, we're going to do the initial assessment. So first, in doing neonatal resuscitation, we're going to do or assess the color, the tone, the breathing, and the heart rate of the baby. If our baby, upon receiving the baby after delivery, if the baby is in good condition, she has good tone, she has good cry, normal breathing, then we can go ahead and do our newborn care, routine newborn care. However, if our baby is cyanotic, she is floppy, she is not breathing, and heart rate is lower than 100 beats per minute, then we have to do our initial steps. First is to thoroughly dry the baby. Start with the face, with the body, and now with the legs. Also need to do the back. Now when drying the baby, we have to make sure to stimulate at the same time. So that is done by back rubbing and also by tapping the soles of the feet. Now let's remove this wet cloth and replace it with a new one. And we have to make sure to keep the baby warm to prevent further heat loss. Okay. After doing that, we have to clear the airway by using our suction bulb. And we're only gonna do this if there's obvious secretion. And we're gonna start by the mouth and the nose. After that, we're gonna go ahead and stimulate the baby, but I already did that when drying the baby. Okay, next is we have again to reassess the color, the tone, the breathing, and the heart rate. If after stimulating the baby by thoroughly drying, if the condition is already good, she is breathing, she has normal heart rate, and she is already pink in color, then we can go ahead and return it to the mother to initiate breastfeeding or initiate skin-to-skin contact. However, if the baby is still cyanotic, she is still floppy, heart rate is still lower than 100 beats per minute, and she is still not breathing, then we can go ahead and start the 5 inflation breaths. Now for 5 inflation breaths, we first have to position the baby's head in a neutral position and take an bag valve mask with an appropriate size of the mouthpiece that is connected to an ambu bag, and put the mouthpiece at the chin of the baby up until the nose, making sure the entire nose and mouth is covered. And we're gonna support the mouthpiece by using our C&E technique, by using the index finger and the thumb to stabilize the mask, and other 3 fingers to hold the jaw. Now when providing the inflation breaths, we have to slowly squeeze the bag, and we have to provide 2 to 3 seconds for each breath, and we also have to allow the count loudly to allow an accurate rhythm. While also doing the inflation breaths, we also have to note and observe for the chest movements. Okay? Now we're ready to give our 5 inflation breaths. 1, 2, 3, off. 2, 2, 3, off. 3, 2, 3, off. 4, 2, 3, off. And 5, 2, 3, off. Now after doing the inflation breaths, we have to again assess the tone, the color, the breathing, and the heart rate of the baby. Now, when doing the inflation breaths, if there are no chest movements, if we didn't see or observe any chest movements, then we have to do to repeat the maneuver and also reposition the baby. By repositioning the baby, we have to use the thumb of our fingers and then place it on the cheek of the baby, and then the other 4 fingers on the jaw, and just lift it gently, and take our ambu bag mask or bag valve mask, place it on the baby's face, and also support it with the CE position, stabilizing the mask, and at the same time still on the jaw thrust technique. Now we are ready to give our 5 inflation breaths once again. 1, 2, 3, off. 2, 2, 3, off. 3, 2, 3, off. 4, 2, 3 off, and 5, 2, 3 off. Now after doing that, we have to reassess for the color, the tone, the breathing, and then the heart rate. If after doing that inflation breaths, if our baby is now in good condition, she has normal breathing, she is already pink in color, then we can go ahead and return it to the mother. But we have to continuously monitor the mother and the neonate. However, if our baby is still cyanotic, she is still floppy, there's still no breathing, and heart rate is still lower than 100 beats per minute, but we have noted some chest movements when doing the inflation breaths from earlier, then we can go ahead and proceed with the 30 seconds of ventilation breaths. Now for the 30-second ventilation breaths, we're using the same technique, draw thrust technique. Lift it gently, take the bag valve mask, position it, and support it with the CE position. And when doing the ventilation breaths, we have to slowly squeeze the bag, and doing it for 1 to 2 seconds for 30 seconds. So let's start. 1, 2, 1, 2, 1, 2, 1, 2, and 1, 2. So after doing our our ventilation breaths, we have to again reassess the color, the tone, the breathing, and then the heart rate. If after doing the previous maneuver, if our baby now is in good condition, then we can go ahead and do our post-resuscitation care. However, if the baby still has no progress, then we have to do chest compressions. Now for chest compressions, we hold the baby's chest by putting our thumb on the lower third of the sternum and just below the nipple line. And when compressing, we have to compress straight down, at least 1/3 depth of the chest, or at least 1.5 inches of the chest. And then when providing chest compressions, we have to do 3 chest compressions, 1, 2, 3, with 1 breath. Now when doing chest compressions, we have to also make sure to give time for the chest to recoil. Now this is done with a partner. However, I'm by myself. I have no attendant with me, so I'm gonna go ahead and position my ambu-bag mask and support it with the CE position. And instead of using my 2 hands, I'm gonna use my 2 fingers. But you have to make sure you're still pressing the chest straight down. So 1, 2, 3, 1 breath. 1, 2, 3, 1 breath. 1, 2, 3, 1 breath. Lastly, 1, 2, 3, 1 breath. Now after that, we have to reassess if there are any changes, if there's the color change, the tone improve, the heart rate increase, or she is already breathing. However, if the baby still has trouble breathing, let's say for example the baby is already slighter pink in color, she has now normal heart rate, but she is still floppy and she still has trouble breathing, and she has irregular breathing, then we have to continue giving the 30 seconds of ventilation breaths. I'll put the bag valve mask, support with CE position, and count for 2 seconds. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. Now after doing that, we have to evaluate for any progress. If our baby is still heart rate is still lower than 60 beats per minute, we have to now administer epinephrine along with PPV or chest compressions, and we can repeat that for 3 to 5 minutes. And after 10 minutes of properly and continuously resuscitation, if there's still no progress, then we can decide, or the discontinuation of resuscitation may be justified. And that's all for neonatal resuscitation.